This morning, I will be playing host to folks from Breakthrough Action here on the Super Money Show. They're already in studio, and I have Eddie Miawe Fangalo. He is the director for Veterinary Epidemiology Unit at the Ministry of Agriculture. And Arvin Koko, the Emergency Preparedness Officer at the National uh, is it a relations focal person? Yeah, at the National Public Health Institute of Liberia. Good morning.
Good morning.
Good morning.
Great. So let first of all start to know about the One Health platform, the whole setup of the One Health platform. What is it all about?
Okay, so thank you so much, and good morning to the Building Radio Line. So first of all, this show is being paid for by Breakthrough Action.
Okay.
But that's one of the partners that are supporting the World Beach Day celebration. We have FAO, we have World Bank, we have WHO, Chimpanzee, Liberia Chimpanzee Rescue Project.
Mm-hmm.
So for me, I'm from Ministry of Agriculture, like you rightly said. I'm the director of the Center Vet Epidemiology Unit. We respond for animal health diseases in country.
Mm-hmm.
So the One Health platform is a platform that deals with human, animal, and environmental health. So that shows that every sector or every entity has a stake in human health, because we know that 75% of diseases that affect human comes from animal,
Okay.
and the animals also live within the environment. So the environment also play key role, because if you see garbage, you see the forest that holds the wildlife, they are also important in transmission of disease to human. So, but basically, we came here today to discuss about rabies, because every September 28th is World Rabies Day.
Today is War Rabies Day.
Yes, please. So, and that's the day that is set aside to celebrate the anniversary of Louis Pasteur, the chemist and the microbiologist that discover vaccines against rabies and anthrax as well. And that's one of the reasons we found here to create awareness, to also inform the public that we are having this celebration at Golden Gate. It starts now at 9 up to 1 p.m.
Okay.
So everyone is invited to this occasion where we'll be doing presentations. We'll have student groupings, and then there'll be question and answers.
Okay. Since today is World Rabies Day, let's look at the word rabies in the first place. What is it?
Okay, so thank you again. So I'm Alvin Coker, and I work for the National Public Health Institute of Liberia as the National Rabies Focal Person, and I'm also an emergency preparedness and response officer. So
Okay.
basically, rabies is a zoonotic disease. It is also a viral disease, meaning it comes from animal and it affects human.
Okay.
And so it is spread from the animal population to the human population through contact with saliva of the infected animals. So all through the world, dog accounts for about 95% of all of the rabies cases in the world. But more to that, studies have shown that other animals also have rabies. I say, for example, in Liberia, we've tested and confirmed rabies in cats. We also confirmed rabies in raccoon, and there are also stories of rabies be present in bats, in foxes, and so forth. So generally, all warm-blooded animals
Okay.
have
rabies.
yes, they are susceptible to having rabies. Not, ideally having rabies,
Okay.
but they can have rabies.
Okay.
And so, yes, so that is what we are here to discuss today, because the situation of of rabies is such that warrants a prompt response, given the kind of devastation that rabies might cause if care is not taken. It is interesting to know that annually we have uh, about 59,000 deaths that are recorded across the world that are due to rabies. And of those deaths, yes, 95% of them are from Africa and Asia. And so this means that if care is not taken, a lot of lives could be lost to rabies, because if a person has rabies, the chances of survival is very slim. So it is 100% fatal. And so that is the reason why it is important for us to raise awareness because the primary source of the infection is from an animal that we hold so dearly to our hearts. I mean, one way or the other, we all might have seen dogs in our community. We all, may have somebody who has dog, and they are just our best friends. So we
It
can
is
really do
because
away with it.
it is because of the proximity, the cohabitation of the human being and the animals, especially dogs,
Yeah.
that you see dogs having the higher percentage of rabies cases.
Sure. Because they are always in our domestic spaces
Yeah.
compared to those animals that are in the wild. So because they are very, very much exposed to it, and they come back to our homes, we interact with them, and so when they are infected, if care is not taken, we ourselves can also be infected.
So what causes them to get it in the first place?
So to just be clear, that dogs were not born with rabies.
Okay.
Okay, so ideally, the virus is really found in the animal in the wild, right? And so that's the reason why we are now promoting this entire concept of the One Health approach, bringing the different sectors together from the human side, the animal side, and the environment. And say, for example, a wild animal is in the forest, eats a fruit or something, and that fruit drops to the ground. Dog is passing, sees it, and take it, and the dog is also infected and comes back to the community and then transmitted to the human. Or, for example, you have an environment in your community that is not properly looked after. People throw dirt there. You have bones and so forth. Dogs will. There are some people who don't really know how to handle pets. They leave them to find for themselves. So they go out into the environment, coming to the to where you have the dump site. You see a lot of things there, and dogs are there coming to pick. Apparently, through that gathering or through that interaction, one of the dogs might have already been exposed, and then while having that interaction, fighting or boom, the other dogs will get exposed, come back home. So that is how
because it's the saliva.
Yes, so it is from the saliva of the infected dog, and so if it affects the human again, it becomes a serious problem.
Okay.
For us.
Okay. So yeah.
So in addition to that, I think we've seen that people use dogs to hunt. And then once you take the dog in the forest to hunt, they might come across some animals that are also susceptible to rabies. And more to that, we've started encroaching also on the animals' habitat. That is, people are doing pit sawing. We are going to where they should be. We are and making farms. We are building our homes in the forest. So if you take away their homes, they have no option but to also come to town. So that's why you see that we talk about the One Health, because the animals live in the wild, and then they spill over because there is an interface between the wildlife and the domestic animals, and then also domestic animals to the human. So that's where the issue is. So if you want to prevent this deadly disease, you have to take into consideration the One Health approach, where you're going to leave no sector behind, because even in the reverse, the environmental sector is more important as well as the animal health sector, because everything we are doing is to prevent human. So if we are talking about treating dogs, keeping environmental space clean, it's all about human safety. So we think you got to take it from that end to be able to have a very a healthy environment, human health.
Okay. And just looking at the One Health platform, is it a conglomeration or a synergy of major actors, sectors coming together? And what are those sectors?
So the One Health platform is a coordination platform. It coordinates the human health, environmental health, and the animal health.
Okay.
So we have three sectors. So even if you are feature, you find yourself under the animal health. If you are everybody, even FDA is within the environmental sector. So the three sectors, because of interconnectedness when it comes to the determinants of health, under the One Health platform that is chaired by Mr. Sompon CA, and also the chair for the technical committee is the DG for NFIL, and the Minister of Health is the overall chair for the platform.
Okay.
So it's all about bringing people together to say, hey, we need to have one group, one body that can coordinate. An important part of that is you avoid duplications, because if you have
and the overlapping of functions.
functions, because if it make people to actually utilize budget well. So, for example, we had a well issue at Doazon.
Mhm.
So what we did was we involve all sectors, and then everyone use just one vehicle. So instead of EPA carrying with one vehicle that we're going to put, let's say, 10 gallons in it and then get DSA for 5, Ministry of Health the scene, agriculture the scene, and other sectors. So just, okay, let's just coordinate well and use just one budget line
Mhm.
with the scene expertise of different levels from different institutions and go and investigate the case. So it also has a good side where we utilize the budget well, and then also avoid duplications and overlap of functions as well. So
Okay.
that's what the platform is for, and that we have been doing that since 2017, and then we see that things are going
Are
well.
improving.
Yeah.
Okay, Avi, let me come back to you. Just because today is World Rabies Day, and I thought we place the focus on that.
Sure.
Do we have some statistics from a Liberian perspective on rabies cases?
Sure, and so it's very much important too that we highlight what the data says as it relates to cases of we want to say suspected rabies or dog bites in Liberia.
Mhm.
So just in 2022, from January all the way to December, we reported a total of 2,093 cases of dog bite. So from
2000.
2093. So from January all the way to December of 2022, 2093.
Hmm.
And then as of last week, because we are still compiling,
Mhm.
we had now up to last week, we had a total of 2,615 dog bite cases.
So it means this year is doubling last year.
Apparently, because we still haven't
See,
come to the end
Just
of the year.
last week it was.
As of last week. So we don't know what we'll see again before the weekend. So this just means that the issue about how we raise the awareness on the management and prevention of rabies is very much key, because now, in as much as we have the different sectors in the fight against rabies, there is also an overarching goal
Mhm.
that all sectors will have to make sure that they achieve. So by the year 2030, it is our hope that we, from the different sectors, we use our different resources and expertise
Mhm.
to see how we can bring to zero the transmission of rabies. So rabies is targeted to be eliminated by 2030. So
Mhm.
if this is to happen, it means that all sectors should be involved. We need to have a system in place that will also keep surveillance on what is happening, and more so also provide proactive preventive measure so that we can have people die from rabies.
Mm.
And it's also interesting too to know that we have also recorded some deaths. So for last year we had 6 deaths, and currently we have seen 4 deaths of rabies. And there are some
So,
counties.
so the deaths are more way below the cases.
So ideally, it is our hope that nobody dies from dog bite.
Mhm.
And there are several steps that we will also like to inform the public that if a person is exposed to dog bite, he or she must ensure that this, and this are done.
Mhm.
But unfortunately, due to some circumstances that we are still investigating, we are still seeing deaths in people exposed to dog bite. And that is very, very much difficult, because the moment a person starts to show signs and symptoms of rabies, there is nothing that you can do for them. 100% that person will die.
Mm.
100%.
Does it come to a point where the rabies is chronic? It reach a death level.
So there are different stages, right? So the part that you're talking about now is the acute stage. Now that means that the person now has already started to show symptoms or signs. So initially, if the person is bitten by a dog, it has to go through a process that we refer to as the incubation period, and that is also dependent on where the person was bitten.
Mhm.
And so initially the person will start to feel feverish, the person will be weak and so forth. So those are some initial signs. And then to where the person was bitten by the dog, the person will experience this intense itch, right? Like something is pricking you there,
Yeah.
like joking. So those are all signs. And if nothing is done at that time, it may progress now to a fatal stage where the person now will be afraid of light, the person will be afraid of water, the person will be very, very much aggressive. And then within 2 to 3 days after the person has progressed to that stage, the only thing that will happen now is death. And in most of the cases, before the person passed out, they will have to, really, really back
Mm.
like dog. So there is nothing can be done. However, there are things that we can do to try to prevent the disease from going to that level. And that is the reason why we are also encouraging people that once you are bitten by a dog, we encourage you the first thing to do is try to seek medical help. And so, in an event where you are far from a health facility, there are some primary things that you can do at the home level or at the community level. So, the first thing that you could do is to make sure that to the place that you were bitten by the dog, make sure that that place is washed for up to 15 minutes with just soap and water. So you do it for up to 15 minutes. And the water that you're using, we encourage you to use running water. So don't just take your hand into the bucket and want to know. So it should come from a faucet, or apparently somebody should have a cup and the person is pouring it out. So you wash it for up to 15 minutes. So the reason why you are doing that, or the rationale beyond that, is you want to try to some extent, to try to reduce the viral load. So you wash it up to 15 minutes and you don't tie it and you leave it like that and you try to go to the hospital. And so at the hospital too, or the health facility, we have people trained on how to manage those cases.
But does it have injection?
Yes. So
Vaccine?
at the health facility, once you present at the health facility, the health worker there will assess the situation, and the health worker is encouraged to give what we refer to as a vaccine, or it's called PEP, the post-exposure prophylaxis. So that vaccine is given to prevent the spread of the disease, and it will also protect you from getting sick. And there are different things that surround how the vaccine should be administered. So it has to also be from what a dog is presenting with, and it also has to do with the category of dog bite that a health facility is really, really seeing. And so that is the reason why in the animal sector it is always advisable that once a dog bites somebody, the community member should make sure that they hold the dog, they observe the dog for up to 14 days. So if that dog is a rabid dog, before the 14 days, that dog will die. And the response in the human population is dependent on the manifestation of the dog. Because trust me, even though we have the vaccines available, but they are also expensive at times that we can't have them in a health facility. So the only way that we can try to fight it is to make sure that we handle the dog population. And that is the reason why we are also promoting responsible dog ownership. Make sure that your dogs are vaccinated. Make sure that your dogs are kept, they are properly fed, so that we can try to reduce the transmission of rabies.
Okay. Eddie, you want to come
Yeah,
there?
yeah. So thank you so much, Avan. So to add to that, for the dog, we been able to confirm about 50 cases of rabies in dogs. Those are just minute portion of samples that were collected. It's becoming a norm in this country that people are eating dogs. So whenever someone is bitten by a dog, we decide to say that's the crazy dog, and then people have it killed. And once that is killed, it's definitely being consumed. But from the animal health side, we need the dog, the entire carcass of the body, to be able to conduct tests for it, and that's the brain tissue. And it will interest you to note that people normally say the best part of the dog is the head. Why are we taking the head to go and test for rabies? So the issue here is we've not been able to get that adequate sample, but over 80% of samples that were collected became positive. That is the number of hairs that we took to the lab, the animal lab that is located in Fendel, to have it tested. After a bite case was reported, it's about 80% became positive. So you know there's an alarming rate that most of the bite cases are linked to a rebite dog. And more so, we also tested rabies in cats. Those cats were bitten by a dog, and then they also start showing signs and symptoms of rabies. So when we took them to the lab and have them tested, they also were positive of rabies. And like Alvin said, we also tested raccoon as well. That was also positive. We had a raccoon from the southeast where we tested, and it also had rabies. So this shows that the prevalence of rabies is something that we cannot overlook, because as compared to the number of dog bite cases reported by the National Public Institute of Liberia. We've not been able to test for all. And also, if you look at the 7 deaths, I think is something that is also underreported because we're not sure what happening in other counties. This is mostly seen in Monserrado, where I can say people are almost aware of rabies, but it's something that we need to really strengthen in across the counties. Because it also takes long for the individual to show signs symptoms of rabies, especially looking at the site of bite, because it's the central nervous system that the rabies virus attack and then goes to the brain. And once they enter the brain, the person start being confused. They become hydrophobic. That is, they don't want to see water. They become very agitated, biting the dog. But if the person is biting, let's say on the toes, and then because that is far from the central nervous system, it will take some 1 year, 2 years. So most of the investigation we've done, at times, the family of the client or the affected person forget to know what really happened because the number is wish. Because if you are beating my daughter 1 year ago and now you are showing signs and symptoms 2-3 years after, you cannot even recollect why it happened. But after some thorough investigation, we say, oh yeah, the person was beating my door, let's say 2021, and then that is we can even trace the dog. So those are the issues. So it's something that is very alarming. Currently, around the world, people are also celebrating this day that rabies is 100% preventable and also 100% fatal. That is, when somebody starts showing signs and symptoms, absolutely nothing can be done.
Okay.
And I've seen those cases where some children bite like dog in the hospitals. We've seen cases where some children went to home scorer, they were beaten and one person died right on the spot. That happened in Lofa. So it's something that we can prevent 100% by vaccinating your dogs. We've been vaccinating dogs since 2019, free of charge. We vaccinate dog and give you certificate every year. And then once your dog is vaccinated, now you can rest assured that the dog is protected against rabies. Even a rabid dog bites it is something that is not going to also get the virus that will be able to affect your family,
Okay.
your children, and so forth. And most of the dog bite cases are below 15 years.
Yeah.
Children are the one that normally plays with dog.
Okay.
Yeah, so most of the cases are between the age below 15 years, and then that's what we have seen so far.
Okay.
So it's good.
Yeah. So these cases, I was just looking at how and why they occur. It said why the dogs have rabies. It said based because of the careless way of or the irresponsible way of taking care of dogs in homes.
Yes, so that's the right word you use. It's sad to say, but most people are irresponsible dog owners. We take dogs to be just anything, and also we go to workshops that has about 500, 1,000 people. You see people running after the bones that are left over in the workshop, and then take it to the dogs. So the way we treat dogs generally in this country is irresponsible. And also we let dogs to also go and fetch for themselves. And also if you have enough garbage area, you cannot feed a dog, and then if the dog goes there to feed, the advance said they will come across another dog that might already be sick, and then they're going to fight over bones. Even when dogs are mating, that's another thing. Some people also keep female dog in their homes without male. So and if you also keep male dog without female. So once you open the gate, they are running to go and look for woman or they're going to look for men. And when dogs are mating, they kind of fight. So we are cruel to dogs, and that's also something that bringing. So it's like a street light. The dog might be green today, it might be yellow, and then become red anytime. So the best thing is don't, because people fear that if you carry female dog and male in a yard, they're gonna start mating in the presence of the children. That is something that you don't want to see, and they don't keep dog. So there are a lot of factors. You cannot feed dog, don't keep them. If you cannot take dog in pair, don't take them. And if you don't have a fence, there's no need to also keep dog, because once they come in contact with each other. And also interested to note that people who hunt with dogs, when we tell them to vaccinate, they say once we vaccinate the dogs won't be aggressive to catch animal. And when you see dog being so aggressive, who knows? They might also come across. So there are a lot of factors.
Okay.
But the right word is most people are irresponsible dog owners because we don't take care of them. Don't take dogs to be something that need life, that need to eat, that need other welfare aspects as well.
And because of that, they are exposed to rabies.
They are exposed to it.
Now, to this this year's celebration of World Rabies Day, what difference would it make? I mean, you have had countless celebrations, anniversaries of Rabies Day. What will change differently to the approach to the fight against rabies?
Okay, so thank you again. So the first thing, the theme for this year's celebration is one that speaks to our conscience, and it says, "All for one, one health for all." So that's the theme: all for one health for all. So it means that each and every one of us, irrespective of where we are, we have a stake in the fight against rabies. So collectively, if we work together, we can stop the spread. And so the kind of new things that we are going to bring to this celebration is that we are going to have an awareness session. So there will be two different technical presentations delivered at the occasion to sort of raise awareness on those basic things that each of us can do whenever we are exposed to animal bite. And we also try to give the current burden of dog bite in Liberia so that stakeholders can know, so that people can begin to take action. And that is the reason why, in addition to some stakeholders from the One Health platform, we also thought to invite people from the public. So we have students coming over to grace the occasion. We also intend to have people from the tertiary institution, different universities to come. We also be bringing on board the health workers so that we can try to constantly remind them their key role that they continue to play in the fight against rabies. And more so, I think we have started a lot of awarenesses. We started on yesterday, and then we are here today. And so this whole week is just about raising the awareness on what we can do to prevent dog bite.
But is there a law or a policy that holds irresponsible dog owners to punish them?
So let me come in with the unique thing we're going to observe on this day before answering that question. So I think since 2019, every year we've been able to improve on what to be done, and it's increasing. So every World Rabies Day celebration brings a unique thing. If you see the trend now, we're having more people now who are aware of rabies. There are also more people who reporting dog bite cases. So this year we also want to see that we're going to have a increased number as compared to last year. So every year has its own way. But now, thanks to Breakthrough Action, thanks to the UNFAO, the World Bank, WHO, the IRC, the Breakthrough Action, who have made this possible. And also the Liberia Rescue, Chimpanzee Rescue Project. But with the law aspect, I think that's where we need to bring in the policy makers, because that has been a challenge. And there's need to be a strong policy that if you want to raise dog, that should be A, B, C, D that you should meet. Otherwise, we'll still be having, because rabies have no boundary. If you're a lawmaker, you are a minister, you can be affected by rabies, even your children, because you might have dogs in your yard, and then once at times you see ministers, once they're leaving the fence, the doors are waiting. Once they open the gate, the doors are gone because they want to go and find something. You don't know what the door is bringing. So that should be a policy document. That should be a law out there to make sure that we have animals to be protected, and that should be some criteria set. Thanks to FDA, that has a law now that look at bringing in chimpanzee, monkeys home. I think they have a law now. Once they see in your homes, they're going to confiscate that, and also you're going to serve some jail terms, because rabies also in monkeys and also in bamboos. Those are all wildlife. Why should we bring them home? So we need to look at that from the animal health perspective and see how we can actually look at the dogs. Now we have it for the chimpanzee and others, but there's a need to actually have a law on dog, responsible use of dog in homes. Otherwise, there will be an issue. We are overlooking it, but there are a lot of deaths that are occurring outside that we don't have records of. But I'll show that once you have 80% of sample collected on dog being positive, there's a high likelihood that definitely most of the animal bite cases are things that need to be looked out for.
Yep. How about you want to add?
So it's important, and that's the reason why, in as much as we don't have such law that really speaks to how we can be a responsible citizen in the way we control or take care of our dog, That's the reason why we are now speaking to each of us as community dwellers or members on how we can handle the issue of dogs. So always try to make sure that your dog is properly fed. Always try to make sure that your dog is taken care of properly. And in the event that that dog bites someone, it is a responsibility of the owner to ensure that that dog is restrained and the right measures are taken. And so, if nothing of such happens, it is also the responsibility of the community members to ensure that the dog is restrained, to ensure that the necessary actions are taken. So, all of us are involved, and we all want to do our part in the fight against rabies.
Okay. Okay, so if you just joined us, you're listening to the Super Morning Show on ELBC Radio. This morning, we're talking about World Rabies Day and the disease itself. This morning, I have in studio Eddie Miawe Fangalo. He is the director, veterinary epidemiology unit at the Ministry of Agriculture, and Arvan Koko is the emergency preparedness officer, the National Rabies Focal Person at Enfield, the National Public Health Institute of Liberia. You can call us on 080514096 or 07705818886, 080514096 or 07705818886. Let's hear you. Good morning. Morning. Good morning. You're very low. Good morning. Anyway, we seem to be having problem with our main line, so call us on 07705818886, 07705818886. We'll use this as the alternative line. Good morning. Morning.
Yeah, good morning.
Yeah.
Yeah, my name is Imas Ketai, and I call you from River Chikande.
Go ahead.
So let me say thank you to your studio guests for their deliberation. I mean, it is important to make the citizen aware about the the rapists. So I want to say thank you to them for the education provided this morning.
Mm-hmm. Okay, thank you so much. Good morning. Good morning. Okay, call us on 0770581886. Good morning.
Good morning, Valerie. This is Mo Adam, and I call from the GSA community.
Yeah, go ahead.
Yeah, Valerie, thank you for the show, and thank you so much for your studio guests. Actually, this program I really I've been sitting listening keenly, and it's very educative. It's good for some of us that like keeping dogs or that have dogs now. So thank you, gentlemen, for the education, and I've been listening and I think I also have to share. But then the question I want to ask is about the vaccine that you usually get dog. Is it still available, or when will it be? Thank you.
Okay, they will respond to that. Thank you. Morning.
Good morning.
Good morning.
Yeah, I'm sure you're in.
Yeah, let's hear you.
Yeah, I also want to on our guest this morning elaboration. I also want to point out when it comes to the human bite. Sometimes when somebody bites, in case they make it for then they say, oh, when I get a baby and take this all up, then at least be. So the issue that has to do with human biting another human. So at least I'm going to go through that stuff.
Okay. All right. Thank you. Morning.
Good morning.
Yeah. Good morning.
This is ELBC.
Yes, sir. Go ahead.
Okay. I want to thank you all your studio guests for the delivery this morning. But my question is, Monrovia as a capital alone has dogs are not being controlled. What mechanism are they putting in place? Like inspection or regular, or going around to make sure and educate people on these things in the community, especially Monrovia.
Okay. So you're asking about dog inspection, right?
Yeah, to make sure that these dogs are just roaming in the street that are not being controlled because our people need education. Some people get don't even know where it has this kind of effect.
Okay. Thank you. Thank you so much. They will respond to that. Morning. Good morning.
Good morning.
Yeah.
Morning.
Yeah.
Yeah, this is something like Okwe and Akoi from Panos Yoruba.
Yeah. Go ahead.
Yeah, thank you. Thank you for this program. I want to say that good morning to my own director in studio, Mr. Eddie Pagalo.
Thank you.
I want to just the issue of rabies is something that is very serious for human health, and there was a program put in place by the REDC program with support from the World Bank, and that program was with the community animal health workers. That means if we use the button to tap a push in surveillance, then we will be able to track every incident in the community, and that was the reason why that community animal health program was introduced. But up to present, that program has been dormant. I don't know why is the fate of that program. So I want for my own director in the studio there, Eddie, to really explain to us why is a program with the community animal health worker, because that will also track information from the community level to the national level on baby bird or baby disease.
Okay. Thank you. We can take a call and return to our guest. Morning. Morning. Okay. Good morning.
Yeah, good morning. Let's be the only one video community.
Go ahead quickly.
Yeah, I don't know how can we get the treatment for the dog. Because the last article so my dog is the person man was a dog, so the killer went on a spend money.
Oh,
I
okay.
don't know how much the dog.
Okay. Thank you. Thank you so much. Okay. Yeah. So you can respond to the concerns.
Okay, so let me begin. So thanks so much for the caller who talked about the community animal workers program. And so from the Ministry of Agriculture angle, we have surveillance officers across the country and have been supported by the REDC World Bank project that just ended August 31st. We also have the community animal workers that he talked about. We train over 250 with support from UNFAO, IRC, and the World Bank as well to be able to have people at the community level. So in other counties, we've been able to get to have a project that have been supported them with the IRCs. I think there are four counties. That is River G, Lofa, Bone, and Green Crew. That taking care of the cows that are there. But the challenge is in other counties, like corresponding community workers, we have not been able to have that support for them. Thanks to UNFAO that's also supporting them based on performance. So my group just called that program is still going, but we have not had support to have everyone incorporated to date. And for the aspect of the dog vaccines, it's free of charge. But this year we're not going to vaccinate dogs because of the time. So early August we are going to move across the 15 counties to vaccinate dogs as usual. But today is only for the awareness creation, and we will be coming back to the community to vaccinate dogs. And also for the area to keep dogs. And I always tell people that every dog has owner. There's no dog that don't have owner. The only thing is because we don't feed them, they go and fetch for themselves. But if you go to the garbage site at night, let's say by 12, you won't see any dog. They are born home. So what we do is you can visit the Ministry of Agriculture office that is around the Jibini Highway. That's the old Ministry of Agriculture office. You can also visit the Central Veterinary Laboratory that is in Fenner. We have kennel we built to be able to quarantine your dogs. So because we don't encourage people to keep quarantining their own dogs, so you just call on the animal health workers. We're going to pick the dogs, take them to the Central Veterinary Lab. UNFA will be the kennel. We can keep them. We also feed them for 14 days, and then when the dog is not a rebel, we'll return the dog back to you. So that's the way we can do it both. don't have mechanism in place to say we'll be living from community to community be able to catch dogs in the street because all dogs have owner. We are just irresponsible dog owners, so they go and fetch food for themselves. Thank you.
Okay, so thank you again for the question. We appreciate all of the concerns from the caller. So just to add to what my colleague has said as it relates to the vaccine too. So the most effective way of preventing rabies is to target the dog population, and that's the reason why we have this event where we can do mass dog vaccination. Like we said, we are planning to do so, but more so, we can also do it to people who have been exposed, and so that's the reason why we encourage you to visit a health facility. Or better still, you can call 4455. So the 4455 line is known as a line for reporting all emergencies, and so if you call 4455, trust me, a community health worker will also come to you and give you the adequate information on what to do. But there are some designated health facilities we have that that are charged with the responsibilities of providing PEP. For example, in Montreal County, we have a designated JDJ retention. We also have it at Dufuro Hospital and also at Benson Hospital. So you go there, PEP will be available there for you, and they should be given to you freely. It is not paid for, so nobody should say paid for it. So in the event that the vaccines are not available, they will refer you to perhaps a pharmacy to go now and buy. But at those facilities, it should be free of charge. Somebody also raised a concern about whether somebody can get babies from just the human bite. Maybe you and a friend fighting, then the person just hold your hair and bites your hair. It's only make baby. No. So it is not proven that people can get babies from such. So the only time you can have baby, except that person has started to show the clinical sign. That is, the person now is hydrophobic. He or she doesn't want to see light. The person is afraid of water. The person is aggressive. The person now is very, very much agitated. And then in that moment, if you have contact with such a person who is symptomatic, you are exposed to having rabies. Other than that, you can't just get rabies from just a mere human bite. But even if you are exposed to that, don't say that suppose you take chicken poop and put it at the bug and post on it. We also encourage you to please visit a health facility, so the health facility can also try to see what they can do to help you be safe.
Okay.
So one key thing, so
Yeah.
please, before we go, so like you said, so let me encourage our community members that the tetanus vaccine is not rabies vaccine.
Sure.
Because often when people get bitten, they say, "Oh, TST is not for that." Tetanus, if someone is bitten by another person, tetanus infection is more applicable. But it's possible the person can get tetanus to that person. And quickly, also, we only look at the dog bites, but it's also good to know that we can get rabies through your mucous membrane. That is your eyes, your nose, your mouth. If your dog plays with you or licks your hand, they don't wash your hands, and the dog has rabies because it's saliva. So if you take the saliva and put it in another place, because the virus only need an opening, you don't need a broken skin to enter. So the eyes are already open, the mouth are already open. So once you put it there, you're gonna definitely get that. So it's not only true bite, but scratches also can also give you the rabies virus as well. Thank you so much.
Thank you. Well, they are from the One Health platform, Virtue Action sponsoring. My name is Vafle Kamara. You can join me